Connected to vaccines, given the increasing threat of vaccine misinformation and hesitancy, what role do scientific advisory bodies, including the Strategic Advisory Group of Experts, SAGE, on immunization at the World Health Organization, play in countering public distrust and ensuring transparency?
Every child gets vaccinated regardless of the amount of vaccines that there is, and we need to really push that forward. On the other hand, we do need to make vaccines more accessible, as we did with the COVID outbreak.
According to you, how can digital tools be leveraged to strengthen vaccine safety surveillance and adverse event reporting, particularly for new vaccines such as acute dengue or COVID-19 boosters?
Electronic data systems are necessary if we really want to have an information system that is worthwhile. We did it during the COVID outbreak. We registered the people so that they could go to a vaccination place safely, and we had a way of following up.
Dr. Alejandro Cravioto is a distinguished physician and global health expert with decades of experience in pediatrics, infectious diseases, and vaccine safety. He currently serves as a professor at the Faculty of Medicine of the National Autonomous University of Mexico, where he also previously held the position of dean. Currently, as the chair of the Strategic Advisory Group of Experts on Immunization at the World Health Organization, Dr. Cravioto plays a pivotal role in guiding global vaccine policy. He's also a member of the Brighton Collaboration Science Board and an advisor to the Pan American Advisory Committee on Vaccine Safety, where he supports Latin American countries in evaluating vaccine safety data, prioritizing the safety of COVID-19 and dengue vaccines. Dr. Cravioto's research has significantly advanced the understanding of bacterial pathogenesis and the effects of diarrheal diseases on child health. With over 190 scientific publications and honorary professorships across Latin America and Africa, his contributions to public health and vaccine science are internationally recognized. Welcome to this interview, Dr. Alejandro Cravioto. It is an honor and a pleasure to have you with us today.
Thank you very much, Dr. Aparicio. Just a point that you made. I was the chair of SAGE until 2023.
Great. Thank you for the clarification. Now, Dr. Cravioto, your research expertise has significantly contributed to a global understanding of diarrheal diseases and their impact on child health and development. Could you elaborate on the key findings of your work in this area and how they have influenced global public health policy?
Yes, my main interest when I was doing my PhD was really in the basic part of microbiology related to bacteria that cause diarrheal diseases. I did that in London, in the University of London. And my main research at the time, which is the late 1970s, was into the adhesive factors. How do the bacteria actually interact with the intestinal cells to be able to cause disease? At that time, those factors, those proteins that these bacteria produce to be able to interact with intestine, are the components of the vaccines we have nowadays against enterotoxigenic E. coli. The two vaccines that have been tested and the one that is being tested now have as part of the components these adhesive factors. And therefore, I am very pleased to say that my research at that time held all the time frame to be able to now be useful in the sense of protection against a disease that keeps on causing problems and deaths in children around the world.
Thank you. Very impressive work. Now, during your time as the executive director of the International Center for Diarrheal Disease Research, Bangladesh, in Chief Scientific Officer of the International Vaccine Institute in South Korea. What were some of the major challenges you encountered in translating scientific research into public health solutions?
I think the main teaching that I had in Dhaka was to really face what it meant to work in a place that did wonderful research on one side, but also offer very humane treatment for cholera and other diarrheal diseases at the same time. I was hired in ICDDRB initially as the deputy executive director. When I became the executive director in 2017, then the first thing that I confronted was a massive cholera outbreak, till we had about 1,000 new patients coming every day. As you can imagine, we had to expand the hospital, and the best thing was that the mortality that we had when we had 200 patients was not different to the one we had when we had 1,000 patients. That means that we were doing the right thing. On the other side, this outbreak gave us two things. One was the ability to study a number of things in the acute phase that translates into better treatment and protection against cholera. And on the other side, it gave us a worldwide exposure. And finally, the changes that we were able to do in the hospital once we got a huge number of donations from all over the world for the work we were doing were some of the things that I feel were part of my job during the 7 years I spent in Bangladesh. In Korea, the time was different. We were working mainly with two vaccines, one for typhoid fever, which now is finally in use, produced by Biopharma in Indonesia. And the other one was looking into the problems of the cholera vaccine that has been so successful up to date in controlling the problem worldwide.
Now, could you describe the process and importance of developing global standards for adverse events following immunization, particularly through your work with the Brighton collaboration and the Pan American Advisory Committee on Vaccine Safety?
I think that the main thing about vaccines is for the people to have confidence that they are dealing with a safe product. The Pan American Health Organization was very worried during the COVID outbreak. And as the chair of SAGE, I was also part of the Global Advisory Committee on Vaccine Safety, which is called GACS, which was dealing exactly with the follow-up of every single COVID vaccine that had been approved for use by the WHO after SAGE had made the review process of the scientific facts and made the recommendations to the Director General of the World Health Organization to give those vaccines an emergency authorization for use. What we found that some people were allergic and had very severe allergic reactions to some of the mRNA vaccines, and therefore we insisted that anybody that had been vaccinated had to spend at least 30 minutes sitting down after the vaccination to make sure that there was no adverse effect. And the second one was to create these regional hubs in each one of the 5 regions of the World Health Organization to be able to follow up each one of the vaccines that was being used in that area to see if there were no side effects. Now, with the Pan American Health Organization, because of the success we had during those COVID times, the expansion of the group into other vaccines was something very useful. And we were able then to start having a much better influence on the surveillance system that most Latin American countries already had to make sure that the vaccines that were being given to small infants all the way to the elderly were safe and secure. I think that is something that the World Health Organization, PAHO, the Pan American Health Organization, and all the regions of WHO have really made a fact. And all the evidence has been published and is clear there.
Thank you for sharing. Connected to vaccines, given the increasing threat of vaccine misinformation and hesitancy, what role do scientific advisory bodies, including the Strategic Advisory Group of Experts, SAGE, on immunization at the World Health Organization, play in countering public distrust and ensuring transparency?
Well, one is to deal with the issue. SAGE had a working group looking at hesitancy, and they published a document about what their were findings. And it's a very different problem of hesitancy if you look at rich countries and poorer countries. In poorer countries, the main problem with hesitancy is the lack of good services. And I think the problem is not hesitancy, but really a problem of dealing with normal life plus the effort to get a child vaccinated. So in that sense, what we have insisted is on one, every child gets vaccinated regardless of the amount of vaccines that there is, and we need to really push that forward. On the other hand, we do need to make vaccines more accessible, as we did with the COVID outbreak. So in that sense, that is one. On the other hand, you have a clear indication of issues related with things that people have. I was saying, without any type of insult, that some people still live in the 17th century. And in those centuries, well, there was no vaccine, so they still are reluctant to use these products because their religion, their customs, or their things don't allow them to do it. And that creates a problem in the sense of trust. But let me give you an example. We have Mennonite communities in Mexico that came from Holland in the late 1800s. And in many of them, they have refused vaccination. When we had in Mexico the polio drive, we decided to go and see if we could convince the Mennonites that they needed to get vaccinated. And it was the Mennonite, the younger ones who had had polio before, who came in with their trousers up, showing the lesions in their legs, telling the elders that they didn't want their children to go through the same thing, and making the elders of these communities accept the vaccination in that sense. I think the problem here is communication. And now with social media, this is a horrible mess, because you have people that have access to this fake information and people actually believe them. And that is something that is not easy to fight against. On the other side, I don't think as scientists, we have done enough to be able to be approachable in the sense of answering questions of people who have doubts about vaccine usage. We have now some web pages, we have now some systems, but it is really something that hasn't been as extreme as the other side has been in the sense of going against the vaccination. I think we need a different attitude, and we need to expect to answer every question that somebody has about any type of hesitancy about the use of a vaccine to be able to convince them.
Thank you. Now that you mentioned social media, the 78th World Health Assembly extended the global digital health strategy to support health systems transformation. According to you, how can digital tools be leveraged to strengthen vaccine safety surveillance and adverse event reporting, particularly for new vaccines such as acute dengue or COVID-19 boosters?
I think the main thing is to have a much better reporting system of two things. We need real census. We are dealing with coverage data that is not real because the denominators are wrong. So we have this idea of, well, 20 years ago there were this many, if they grew at this, then they must be this many now. And that's how we calculate these things, which are completely unreal in many ways. On the other hand, electronic data systems are necessary. We really want to have an information system that is worthwhile. We did it during the COVID outbreak. We registered the people so that they could go to a vaccination place safely, and we had a way of following up. When I was in Dhaka, we had a system in the hospital that collected data, and we had to wait 1 year before we knew how many patients with cholera had arrived in the hospital the year before. 1 year. When we put an electronic system in place, and I'm talking to you about many years ago, then we were able in 2 months to have the information that we needed in a very faster way. So I think this is for the convenience of all. Now, the only thing here is the worry about access to this information. And that, if it's personal data, needs to be qualified and secured. That I agree with. But on the other hand, sharing that information is also useful to understand the problems of global health. And if we all use the same system, then we're all going to be on a much safer side.
It definitely has its benefits. Dr. Alejandro Cravioto, thank you for your outstanding leadership and lifelong commitment to advancing global child health, vaccine safety, and immunization equity. We are grateful for your scientific contributions and look forward to your continued impact on global health. Thank you very much.
Thank you for inviting me.